And I've always been interested in the contrast between Scotland and England, but they really approached recovery from very, very different perspectives. And this is something we summarised in an edited volume of the Journal of Groups in Addiction and Recovery, which is sadly no longer with us, whose editor, Jeff Roth, allowed us the opportunity to characterise what was going on at that time. But the point of it policy was, in essence, the Scottish Road to Recovery policy in 2007 largely grew out of the success of the Mental Health Scottish Recovery Network. And the basic rationale was, well, it's worked in mental health, why can't we try it in substance use? A strength-based positive approach that was really inspirational. In England, it was very much a contrast, as I'm sure you're aware.
Yeah, it was, yes.
Part-on methadone crisis and the massive treatment system with a front door and no back door, underpinned by the very Blairite targeting models of NDTMS and numbers entering drug treatment, which, always struck me as hugely challenging.
And we should add an explosion in quite vicious commissioning and recommissioning at the same time as well.
Absolutely. And the system was clearly a mess. And really going back historically for people who are interested, there was a major turning point when Paul Hayes, the chief executive of the National Treatment Agency, was interviewed by Mark Easton of the BBC and stuttered his way through non-answers about why nobody ever appeared to successfully leave treatment.